Hi, and thank you for joining me today. I'm Andy Hembroff, Laboratory Account Consultant here at Respirare Labs. As awareness of environmental exposures continues to grow, many healthcare providers are seeing more and more patients with questions about mold and mycotoxin exposure. In this presentation, we'll discuss how mycotoxin testing can be aligned with patient exposure questions using practical exposure framework designed for healthcare providers. Our goal is to help clinicians like yourself better understand when testing may be appropriate, how exposure history can inform interpretation, and how these conversations may support broader clinical decision-making. Today's presentation is designed to connect environmental exposure history with laboratory interpretation in a practical way. We'll talk about why the home environment plays such an important role, why mold testing is sometimes misread, and how more effective exposure questions can improve clinical context. We'll also cover how AMEA, Airborne Mycotoxin Environmental Analysis, and MESA, Mycotoxin Environmental Surface Analysis, fit into the process and how providers can apply that information in practice. Before we get started, I wanted to share with you why this work is so personal to me. I myself am a toxic mold survivor as well as a Lyme disease sufferer. I found my passion in this industry out of a place of necessity, and for the past few years, I have worked as an advocate and educator in this space. Unfortunately, a couple of years ago, my health started to decline again. After traveling away from my home, I became certain that I was being exposed in a very specific part of my home. I felt very symptomatic in one specific place in my home. At the time, I had access to more inspectors and resources than most folks, and so I had multiple inspectors through that space and ran a variety of tests. Unfortunately, none of these efforts confirmed what I was feeling, what I knew to be true. It wasn't until we did an AMEA, Airborne Mycotoxin Environmental Analysis by Respirare Labs, that confirmed that I did indeed have very high levels of airborne mycotoxins. This one data point was truly our turning point in my health, and it led us to do exploratory remediation, which uncovered very hidden water damage and mold. Respirare Labs founder and president Mark Ritacco comes from the other side of things. Mark was an investigator and remediator for many years in Portland, Oregon, doing thousands of assessments and remediations. Oftentimes, he came in contact with families like my own, families that had done remediation. They passed all the post-remediation verification mold tests. However, these families remained sick. Mark knew something was being left behind, something that we were not able to test for. In 2022, Mark sold his business and attempted to retire. And I'm so grateful that he came out of retirement to launch Respirare Labs here in the United States. He is dedicated to filling that gap in the industry and for advocating for families like my own. I want to talk about money and resources for a moment. For many families facing environmental illnesses, resources are a great obstacle in their healing. And unfortunately, these families are duly tasked with diagnosing and healing both their home and their body. And unfortunately, more often than not, these require out-of-pocket expenses. Unfortunately, you as their healthcare provider are sometimes the only folks that truly understand the impact that their environment has on their health. And so how you direct them can be really impactful. I believe that there should be an order of operations in the diagnostic process. And this is something that is accepted in the world of health. When we go into the doctor and we say, "Doctor, I don't feel good," the doctor typically won't start with an MRI and a biopsy. Typically, our doctor will listen to our complaints, look over our medical history, do a physical exam, maybe look at our vitals, and then perhaps run a basic blood panel. Sometimes we go back to our doctor and they say, "Andy, your labs looked good. I'm going to send you to this specialist next," or "I'm going to order this test." Diagnosing a home isn't unlike diagnosing a human body. A home is a living and breathing entity. And so an order of operations should also exist. In my very humble opinion, I think that starts with a very thorough visual inspection using foundational tools such as thermal imaging, moisture meters, particle counters, more rudimentary mold testing methodologies, spore trap air samples, swabs, tape lifts, those sorts of things. This investigation should be done with a clinician of the built environment, somebody that is very acclimated with the anatomy, if you will, of the built environment, knowing changing building codes and how the home is constructed. Unfortunately, there are limitations to each and every tool that we use and limitations to a non-invasive inspection. Therefore, having access to more advanced diagnostic tools can oftentimes be the turning point for some families like my own. And that's the point I want to get across. There is a time and a place for each test in each tool that we use, but we must understand what question are we asking and understand the limitations of each tool that we're using. Just like in medicine, each and every test has its time and place and answers a different question. And having this discernment is really important for both your clients and their resources. For example, spore trap air sampling, which is a biological sampling methodology, is going to identify mold spores in the air down to the genus level. Having this information can be helpful to indoor environmentalists. In the mold world, mold is categorized by water activity needed to grow. So knowing the genera of mold spores in the air tells a story of water damage. However, there are many limitations with spore trap air sampling, which needs to be understood. Tests like AMEA and MESA, which focus on the dust of the home, can really give a good historical view of the home, but do not always represent exposure and what the occupants are actually being exposed to. Looking at DNA fragments of mold spores and things of that nature. Surface samples are going to look at very focused surfaces and tell a small part of the story. Mycotoxin air testing, AMEA, airborne mycotoxin environmental analysis, is going to show what occupants are breathing in the space and show exposure and pathway. So really important to understand there is no one perfect test and there is a time and a place for each. So as we get into the exposure alignment framework, we're going to help you understand that and find the value in each test along the way. On the topic of understanding different environmental tests and understanding where they fit into the bigger picture is understanding the big difference between biological testing and chemical testing. So mold is a living organism, and mold testing is looking at biologicals. And there's a few different ways of doing this. As I mentioned in the previous slide, identifying mold spores through microscopy and identifying their genus is impactful and tells a big part of the story. Other sampling methodologies for mold might include quantitative PCR, such as AMEA is using, or HERTSME, which is focusing on dust, and then it will speciate these molds based on these DNA fragments. Mycotoxin testing, which is a totally different hazard, looks at different things. So mycotoxins are, as their name denotes, they are toxins. So they are not living, you cannot kill them, and they do not multiply. So mycotoxins are secondary metabolites of certain toxigenic molds. So unfortunately, when we look at a biological mold test, a lot of assumptions are made. So we might make the assumption that because the Stachybotrys genus is present, we are going to assume that that mold is producing mycotoxins. With dust sampling using quantitative PCR or looking at DNA fragments, we're making a couple assumptions. We're assuming that these DNA fragments are illustrative of mold actively growing and in the home and then actively producing mycotoxins. And then the third big assumption that we make is that the occupants are actively being exposed to it, which unfortunately is not always the case. So there is no one perfect environmental test, and knowing the difference between the hazards that these tests look for is really important, biological versus chemical. So now that we understand that there is no one perfect environmental test, and there's a difference between biological testing and chemical testing, I want to introduce you to the exposure framework. So when you are encouraging a patient or a client to test their home or you are directing them to an indoor environmental professional who's going to develop a sampling plan, you must obtain an objective and understand this exposure framework. So for example, the first question that you need to ask is, what hazard are you looking for? Is it biological or is it chemical? So if you have a client and you have identified biomarkers that are reminiscent of mycotoxin exposure, then the hazard that you're looking for in their built environment is mycotoxins. It's a chemical hazard. The second is pathway, and this is really, really important. So when we are talking about mycotoxins in the built environment, the pathway, the way in which these things enter our body is through inhalation. And so important to understand that. And what do we inhale? The air, not the dust. And that's really important to distinguish the two. And that leads me into the domain. So within the built environment, and when we're talking about mold and mycotoxins, there's 3 domains in which these contaminants can reside: surfaces, air, and dust. So, but it's the air domain that is really impactful because we go back to the pathway. How are these things entering the occupant's body? And that is through inhalation. So, and this is also really important to understand that presence of a contaminant within the built environment does not always equate to exposure. And we know this. Historically, we can look at lead and asbestos. So we know that these things can be present within the built environment, but as long as there's not a pathway, the occupants are not being exposed to those things. So really important there. Also is timing. Is this exposure happening now? Is this a historical perspective? A historical perspective might best be identified by looking at the dust and seeing what's settled over time. If you're wanting to know what the occupants are being exposed to right now, you measure what's in the air. And then the last is verification. So you have these families that are paying out-of-pocket expenses to remedy these issues in their home, to remediate, and we need to verify that those efforts were successful. And that's really important to understand. So for example, dust sampling does not belong in a post-remediation verification setting because there should not be any dust left to test. So understanding this framework and understanding there is no one perfect test is really important as you direct your clients and your patients, because it's going to help them make a bigger impact in healing and moving forward. Testing is just part of this process, and testing the environment is just one part of the process. So helping your clients choose tests that align with the framework and their objective and helping them move forward in the best way possible is very impactful. I just want to touch on this point, and that is the breathing zone and pathway. So only what enters the breathing zone is what the occupants are going to be exposed to. And we're going to touch on this later in the presentation, but Respirare Labs, AMEA Airborne Mycotoxin Environmental Analysis, the sample collection methodology was designed to very naturally mimic inhalation. So we designed this technology to target that breathing zone and to mimic natural inhalation. So this really matters when we are guiding these patients and we are trying to be realistic and cognizant of their resources. We really have to understand exposure and pathway and exactly how that happens. So we'll touch more on that later. I mentioned this earlier, but mold and mycotoxins can reside within 3 very distinct domains within the built environment. And those are dust, air, and surfaces. And testing each of these domains tells a different part of the story. So, for example, dust is a great domain to test to look at what is accumulated over time, a historical perspective. Surfaces are going to be very targeted. And I like to think of surface sampling for maybe looking at contents, for post-remediation verification, what has truly settled on a specific surface, very targeted. Now, the air domain, of course, is so impactful, and especially for that exposure pathway. So what's in the air is what the occupants are truly being exposed to. So again, really important to distinguish between biological and chemical hazards, and then also the domains in which we are targeting and in testing, air, surface, or dust. So now that we've established that there is no one perfect environmental test, Each test is going to answer a different question. We are looking at biological hazards, chemical hazards. We're looking at different domains, dust, air, surfaces. We're looking at different timing. And then when we add somatic testing into that, things can really get confusing. And sometimes some of these data points won't line up. They seem to contradict. And they're not necessarily contradictory, they're just lacking context. And for example, you might have a client that has a positive biomarker, but a negative air test, or a negative biomarker and a positive dust test. And so again, having this understanding of these different sampling methodologies, their limitations, looking at the data analysis used, where they fit within the framework and order of operations in the diagnostic process is really important. And it can be frustrating for some of these clients. They want to see these data points line up. If you find something scary in their body, they want to find the source of it within their built environment. And unfortunately, it's not always that easy. Sometimes we're carrying around these toxins from past exposures, from school, from old homes, maybe college. They come from our food. And so I often tell my clients, don't miss the forest for the trees. And also understand that some of these things are just looking at different aspects of a more complex system. So help your clients choose the right test to answer the answer that they are seeking, and understand the strengths and limitations of these tests so that we can forego some of this confusion and have more clinically relevant data and a clear path forward. So just to summarize, and I'm going to be a little bit redundant here, but I am such a proponent for objective-based testing. In other words, when you're choosing a test or directing your client to choose a test, what question are we hoping to have answered? And again, having this basic understanding of the exposure framework, the different domains, and what different tests are, whether we're testing for mold or chemical hazards, is really important. So when I am helping a client and they ask me what test they should take or run in their home, I ask them, well, what question are you hoping to have answered? And then the second part of that question is, how is this data point going to help you move forward? That's so important to stop and think before we just develop a sampling plan. Also really important to understand that presence does not always equate to exposure. Detection doesn't always equate to illness. And so we really have to have that understanding. And when you as their provider are perhaps running a test and confirming biomarkers in their body that suggest they've been exposed to mycotoxins, unfortunately, those tests don't tell us, well, this came from your food, or this came from school, or your past environment, or your current environment. So we're helping these clients navigate very complex, multifaceted illnesses, and having a deeper understanding of what these tests tell us and what they don't, and where they belong in the diagnostic order of operations is so helpful. When we talk about air testing, it's really important to understand that not all air testing is created equal. So it's not fair to say, oh, air testing is crap. And I hear that a lot, unfortunately. We have air tests for many things, not just mold and mycotoxins. So first and foremost, traditional mold spore air sampling is very different than mycotoxin air sampling. The sample collection is different. The media is different. We're targeting very different particulate matter within the air. So not comparable at all, and really important to make that distinction, because we do ourselves a great disservice by dismissing all air sampling based on the limitations of, say, mold spore trap air sampling. So again, spore trap air sampling is looking at biologicals. It's looking at, compared to mycotoxins, very large mold spores in the air. Samples are typically taken at 15 liters per minute for 5-10 minutes. Mycotoxin air testing we are looking at chemical hazards, and we are looking at ultrafine particles, different sample collection at different rates with different media, different methodologies, and really important to just make that distinction and not make the blanket term in regard to air testing. I am very excited to introduce you to Respirare Labs AMEA airborne mycotoxin environmental analysis. This sampling methodology utilizes what's called an IOM sampler, originally developed by the Institute of Occupational Medicine. What makes this collection method so important is that it was specifically designed to naturally mimic human inhalation exposure. In other words, we're not simply measuring what has settled onto surfaces over time. We are evaluating what may actually become airborne and available for inhalation within the indoor environment. Another major advantage of this methodology is that it aligns with multiple international standards for aerosol and inhalable particulate sampling. This means that the collection process is reproducible, standardized, and capable of generating clinically relevant environmental data in quantifiable amounts. In the laboratory, analysis performed is using ELISA, or enzyme-linked immunosorbent assay, allowing for quantification of specific mycotoxins present within the air sample. Samples are collected directly within the breathing zone at a flow rate of 2 liters per minute over 60-minute collection period under active conditions, helping us illustrate potential exposure pathways other than simply documenting historical presence. For clinicians, inspectors, and clients alike, this provides for a much more exposure-focused perspective of the indoor environment. Airborne mycotoxin environmental analysis, AMEA, is a wonderful tool for exposure assessment, room-to-room comparisons, post-remediation verification. It's going to give these clients clinically relevant data as to what they're actually being exposed to and where. And also, it's going to provide them with really honed-in data that will help them take a step forward with clarity and precision. Next, let's talk about MESA, Respirare Labs Mycotoxin Environmental Surface Analysis. This surface analysis is really great for very targeted objectives. So for example, I like to recommend this sampling methodology for contents, post-remediation verification of surfaces. It's a wonderful tool to evaluate the HVAC system to identify if it's acting as a pathway or a source. But one of my favorite uses of this tool is on contents. In the mold sick community, so often families are told they have to get rid of everything. This can really be a burden financially, it can be emotional, and a lot of times these families are operating out of fear. And so now it's great to have a tool that we can test these contents and say, yes, it's contaminated, or yes, we cleaned this successfully and now I can move it back into my home with confidence. So by now you have a better understanding of which environmental test is going to be the best fit to answer specific questions. So again, to recap, if you are concerned about mycotoxins in the breathing zone, airborne mycotoxin environmental analysis is the right test to answer that question. If the question is regarding contents or surfaces or the HVAC system, the MESA surface analysis is the best test for that question. MESA and AMEA are both wonderful tools in post-remediation verification, ensuring that remediation practices were successful in removing these toxins. If you are aiming to answer the question that is looking at historical accumulation, then dust sampling is the best way to look at that. So the right tool depends on the question that you need answered. So help guide your clients through that process and encourage them to ask those questions. Next, let's look at a sample report. So these sample reports can be read with so much ease, very easy to interpret. We are either seeing detect or non-detect. We should not have detectable levels of mycotoxins within the indoor space. We have 2 options for lab reporting. We have our basic panel that looks at aflatoxins B1, B2, G1, G2, ochratoxin A, and then the trichothecene group. I like to start with the basic panel. For an additional cost, the clients can also add on 3 additional mycotoxins, fumonisin, vomitoxin, and zerolone. Honestly, we don't see these mycotoxins show up in the indoor environment a lot. I typically like to encourage people to run two samples with the basic panel rather than one with the extended panel. However, if your clients are ever unsure of which panel they want to run with or how many tests they want to do, I'm happy to jump on a phone call with them and help talk them through it. I want to shift gears here a little bit and talk about post-remediation verification testing. So PRV, or post-remediation verification, is a process that's done to ensure that remediation was done successfully. Now, our industry is evolving, and that's very exciting, and it's very much needed because traditional remediation practices, unfortunately, do not address mycotoxins. And so the tools used in post-remediation verification really matter. It's just a really important process and one that's often misunderstood. So first and foremost, when we're in regards to mold and mycotoxins, and we've covered this earlier, there's 3 domains that these contaminants can persist in. Dust, obviously, on surfaces, and then in the air. The problem with using dust sampling in a post-remediation verification setting is that there should not be any dust left to test. In my humble opinion, if I saw dust in a remediated environment, I would instantly fail that remediation. So, and also, pre-remediation testing methodologies have to mirror that of what's being used in the PRV setting. Those post-remediation verification processes are meant to protect the consumer and the homeowner and also the contractors. It's a way of saying, here's what we agreed upon and the work has been done successfully and it is safe for reentry. So post-remediation verification testing should involve a good thorough visual inspection. We want to ensure that the mold-damaged building material has been removed. We want to make sure that the source of moisture has been mitigated. And then also we want to ensure that the pathway exposure has been meaningfully reduced. And so in my humble opinion, post-remediation verification sampling plans should be very robust and looking at all of those domains, particularly the air, because again, that is where exposure occurs. And this is one reason that I am really excited to introduce Respirare Labs technology, AMEA Airborne Mycotoxin Environmental Analysis, and the MESA Mycotoxin Environmental Surface Analysis. These tools are wonderful in confirming that the remediation was done successfully. Also, when you're working with clients that are navigating environmental illnesses, and ensuring that they identify the source and where this exposure is coming from, and then appropriately take care of these things. And so these post-remediation verification processes are really, really vital to their healing journey. As healthcare providers, many of you are working with patients who are investing enormous amounts of time, energy, and financial resources trying to identify whether their environment may be contributing to their illness. One of the goals here at Respirare Labs in developing our affiliate program is to help bridge the gap between clinical care and meaningful environmental data. Through this partnership, your clinic will have access to sampling methodologies designed to provide clinically relevant information. Data points that better help illustrate potential exposure pathways rather than simply documenting historical presence of contamination. The program also allows participating providers to pass along savings to patients who are often already managing significant out-of-pocket healthcare expenses. But beyond the testing itself, we believe education and support are just as important. As affiliate partners, you'll have access to ongoing educational resources, training opportunities, and continued support from our team here at Respirare Labs. We also provide complimentary pre-order consultations to our homeowners to help determine which testing strategy is most appropriate for their unique situation, because not every home and patient concern requires the same approach. And once those results are received, we offer free laboratory result consultations to help providers and clients better understand what the data may or may not be indicating. In addition, our healthcare provider partners gain access to a network of indoor environmental professionals. This helps connect patients with environmental professionals who understand these complex exposure concerns. Thank you for being here today, and we are looking forward to serving you and your patients.